Excellent. My name is Kiala Jacques, and I am one of the assistant directors at Source. I'm so happy to have you here with us today, and I will be serving as your MC for the duration of our session. So welcome. We're glad that you're here, and thank you to the MPH office for allowing us to be a part of the conversation and really preparing you through this preliminary conversation with community partners and stakeholders as an introduction to working with the community. So as I said, my name is Kiala Jacques, and I work in the Source office with an amazing team of people who are dedicated to helping you understand and identify ways to be involved with the local community in a strategic and mindful way. And so if you haven't been down to visit us, we are in the suite W1600. We would love for you to come by, just say hello, get to know us a little bit better, perhaps provide hugs. I've been told that you need at least 15 meaningful touches a day. So we do provide hugs as a service. Come on in, we'll share a hug with you. We also service not just the School of Public Health, but the School of Nursing and Medicine and the work that we do. So I'm gonna spend a little time, this is my commercial plug, before we get into our conversation and tell you more about the work that happens. So before I talk in depth about the work of Source, I need to tell you about the team of Source. Can my team please stand? I would love for you to wave to the crowd and let them know that you are here. Everybody, give these folks a round of applause. So this is my stellar team. Mindy Levin, who is our founder and director. Kristen Wright, who is our associate director. Glenn Ross is an outstanding community partner who consults us and helps us be mindful in the things that we do of how we impact and work strategically with the community. Vanessa Pinckney is our administrative coordinator. I have already introduced myself, and my counterpart is Shane Bryant, who is our other assistant director. So if you see any of these bright, shining faces, know that we are the Source team. We are here to support your process and help you understand more about the work that can happen through your time here at JHU. So the mission of Source really is to be both an academic and a professional development tool for you while you're here at JHU. We not only, as I said, work with the School of Public Health, but with medicine and with nursing, ultimately leading you through opportunities for community service and service learning to serve the local community. So what does that mean? What is the service learning thing? Service learning is a structured learning experience that really allows you to get involved in community service that aligns itself with your coursework. And so we celebrate the opportunity for you to give back in your process of receiving as a learner. And we recognize that in the practice of service learning and the pedagogy of service learning, there's a very important aspect. We often say that the dash between service and learning is reflection. And reflection helps you understand yourself in context, helps you understand the history and the culture that surrounds service to the community. And so it's an integral part of service learning. The other elements of this definition include really working with the community on things that they have identified. So a lot of us have big hearts and we want to make the community better, but most often we neglect the fact that they're the experts in what they do. So we lean into the opportunity to hear from our community members and allow them to guide us in what their needs are and addressing their concerns through this structure of service learning, so that there's a context and there's connection not only, as I said, to your course, but to your experience as a member of this community. Yes, you're only here for a year, but in that time, you become a part of the thread that is Baltimore. And so service learning really allows you to understand yourself in that context and then to carry that context with you as you leave and lead as a citizen. So our hope and goal is that through service learning, both curricular and co-curricular opportunities, you become smarter, wiser, more adept to serve in the community, not only in your professional, but in your personal life. So this is the part where I tell you a little bit about some of the great opportunities for curricular connection. Now, there's not a specific designation for service learning courses in your course catalog, and so in order to find out what courses have this connection between service and the curriculum, we invite you to check out our website and take a look at the courses that are available to you in your specific programs. We also invite you to get involved in other ways. So we have the opportunity to be led by stakeholders who value this work, both inside the institution and outside of the institution. We have a community council, we have an executive governance board made up of deans and faculty and staff, but we also have a student governance board. So I want you all have your laptops out, that's perfect. I want you to go ahead and go to source.jhu.edu and check out the opportunity to join as a part of our leadership structure and our student governance board. Now, you only have a week left if you haven't already submitted your application, but on Sunday at 11:59, that opportunity will close. So act quickly. It's Monday, and before you know it, the hours will get away from you. So this is the part where I celebrate the amazing community stakeholders that we have who are involved in service learning, who are involved in connecting you to what's happening in the community, and give them the opportunity to share with you some tips and some tricks and some tools for navigating the opportunity of serving. Thank you in advance to all of you for taking the time to join us and to share with our students. So we'll start, because we only have an hour and I know that there's so much that you want to say, with introductions. So if you will all tell us about your role and the way that you serve in the community along with your name, although they see your bright and shining faces on the screen behind you.
Hello everyone, can you hear me? My name's Omeid. I'm a master's in nursing and master's in public health student, finishing up in 2 weeks, so almost there. During my 2 years in this program, I've worked on a lot of different projects. So one of the main ones was Project Impact, which partners Hopkins with the health department to link people who are HIV positive to care, and then people who are at high risk for getting HIV to PrEP, which is pre-exposure prophylaxis. So that's been a really great experience to work both in the community and the health department and do a Hopkins run project. Another experience that I had that was really great was I worked with the Transgender Action Group, which is TAG for short. They do once a month walks from 11 p.m. to 4 a.m. in Charles Village, where there's a lot of commercial sex workers, most of them transgender, and we link them to, we bring them into a safe environment, do HIV testing, talk about any services that they need. Free State Legal is also there to link them to legal services that they might need. So that's been a really enriching experience that I really appreciated during my time here. Last, I was a member of SOURCE, or sorry, of course SOURCE, but also SPARK, which is Students for a Positive Academic Relationship with the Baltimore Community. While SOURCE looks at how do you get involved in the community and do service learning, SPARK looks at what is the role of activism in public health and how do you really advocate for the community you want to work with, but also within the institution you're in. How do you make sure you as a student hold the institution accountable to the community it's situated in? So for us, it was looking at the administration here and seeing what is Hopkins Public Health's role in the community and how can we further strengthen the connection between the two.
Hello. My name is Lauren Hosterman, and I survived my first year of my PhD in the Population, Family, and Reproductive Health department. And I also did my MPH here part-time, though, so it took me 2 years. And I've been working with the Living Classrooms Foundation in something called the Identity Clinic. And it was originally a collaboration between Hopkins Source as well as Living Classrooms, that there was an identified need that people returning from incarceration were coming out with nothing. They had no birth certificate, no social security card, nothing to get started, no ID. And ID is a very, very important way of applying for government benefits, getting a legitimate job, as well as taking GED classes, that sort of thing. And so a lot of people trying to do well and trying to reintegrate and kind of turn their lives around were stopped by something what I originally thought was such a simple, easy process. I was very wrong about that, but to get an ID. So the Identity Clinic was born and originally trying to help people that were navigate the process of being of getting an ID after returning from incarceration. However, we opened up our doors in January, and I started out as a volunteer helping citizens of Baltimore and community members kind of go through the documents, find out what they need, trying to advocate on their behalf, and then also helping the organization helped with vouchers to pay for the documentations and also transportation. But we were, I would say, overwhelmed, realizing what a need it was in the community to help people get ID documents. It wasn't just people returning from prison. It was foster care children. It was grandparents that had, they were taking care of their grandkids. It was also, we had a huge homeless population coming in that were working under the table. Or also, we've had a lot of people that are in recovery and have lost everything. So it has been, I think we've served 400, 500 people so far, and we're open every Friday, 10 to 12. So the response has been overwhelming, and we have a lot of thankful people for that. So my capacity is, as I volunteered originally as being a clinic navigator, so working one-on-one with community members to help them meet their identification needs. And currently this summer, I've been coordinating the clinic, and that can be all of the above. It can be helping clients. It can be kind of running around getting things done, trying to find other ways that we can help participants above and beyond. Sort of, it's not a simple process to get ID. So that's my experience.
Hi, is this on? Yeah, okay. My name's Roni Neff, and I'm an assistant professor in environmental health and engineering. And I'm also a program director at the Center for a Livable Future, which is an academic center that focuses on food systems and public health. And within that, we also have a brand new MPH concentration on food systems and public health, which has a lot of community engagement opportunities within it. And I teach the service learning class, Food System Sustainability Practicum, and I also teach a class that's not service learning, but has a lot of community engagement within it, which is a class about the Baltimore food system. And within the sustainability practicum, we do student teams working on various projects, and we've had, just to give you a flavor of some of the types of projects students have done, I do a lot of work on wasted food, and so we've done a lot on, for example, food recovery and how, we waste 40% of the US food supply. It's shocking. And there's also, 1 in 7 Americans are hungry. So we do a lot of things with helping people to get more of the food recovered. We've done work on urban gardening. We've done work on trying to, some of the projects have used various skills that students have. For example, we've had some veterinarians come through the class, and so we did a project looking at feed for fish in an aquaponics facility, which is an urban farm in the city. We've had students doing program evaluations or grant proposals, all different kinds of things. And then in my other work, I also do some community engaged research, just wrapping up a project that will be released in the next week or so, which was working closely with Baltimore City on a resilience plan for the food system. So if we get hit by some kind of major disaster, what's going to happen? We know that a quarter of the city's population is already food insecure, so how much worse could it get if we don't prepare in advance? So, and that involved a lot of working with community members, community interviews, things like that. And there's a lot of opportunities for students to get involved in those projects as well, like as research assistants, things like that.
And hi, everyone. My name's Janice Evans. I'm a faculty member here in the School of Public Health in the Department of Biochemistry and Molecular Biology. So yes, there are basic science departments here in the school. It's one thing that distinguishes the Bloomberg School. And I am eminently grateful that I was lucky enough 4 years ago to get accepted to the Faculty Fellows Program, where SOURCE takes faculty within the school and teaches us the service learning pedagogy. So I've been teaching a service learning course for the past 2 years. This will be our 3rd year. And my research area is reproductive biology, so the biology of reproductive health, fertility, and infertility. And in my service learning class, students partner with a variety of different CBOs. We've worked with Youth Opportunity Baltimore, with Be More for Healthy Babies, Mi Espacio, and I think I'm forgetting one. Oh, Community Adolescent Sex Education, and hoping to find some new partners even this year. But the concept beyond the class is extending the basic biology in an experiential learning context that is based in service learning, and actually allowing students to use the biology of reproduction that they learn in the class out in community service projects. And it's been tremendously fun the last few years, and we look forward to another great year this year.
I'm Mike McKnight with the Green and Healthy Homes Initiative. We're a nonprofit focused in Canton, looking at improving housing conditions for Baltimore residents, especially looking at issues around lead poisoning, asthma, energy efficiency issues, and fall and injury prevention for older adults. We interact with our community in a variety of ways. We have case managers that are working with families every day. We have home inspectors that are from the community that are inspecting homes and apartments. We have a crew that actually does physical repairs, so like remediating mold, remediating lead paint, those sort of issues. We have attorneys on staff that help the community, especially around the landlord-tenant issues. And there's a rent court here in Baltimore, and we're involved in that. And then also looking at policy and advocacy issues. And so we've interacted with SOURCE and Hopkins students in a variety of ways over the years. Some of the projects that come to mind. When we started working with older adults more, we had a group of students from the qualitative research class do some focus groups and interviews with stakeholders and some of our older clients to really help guide us in how to serve that community better. We also had a student that spent the academic year looking at what are the perceptions of our families that we serve around asthma and the asthma management of their children, because we had found that there might be some disconnect between what medically is people would feel is a well-managed asthma and what the actual community members think are well-managed. And so we had that a student help us with that. We've also had students help us with looking at the intersection between community-based organizations and healthcare partners like clinics and managed care organizations, the health department. So, thanks.
Good afternoon. My name is Angela Hall. I'm the Volunteer and In-Kinds Coordinator with the Franciscan Center. We're one of the longest running nonprofits in Baltimore. We're running on our 50th year. We're like a one-stop and shop where we're assisting a lot of the disadvantaged citizens of Baltimore with IDs, birth certificates. We have case management. On a daily basis, we have a daily lunch program where we serve anywhere from 300 to 600 people a day. We have a lot of Hopkins students come through who are helping serve some of our lunches, our dinners. They're also doing things like health fairs and helping us with new initiatives to better serve our community.
Excellent. Thank you all for your introductions. So let me inform you how we'll move forward. We're going to have about 30 minutes for our panelists to answer a number of questions. Then afterwards, we're going to give you the opportunity to ask questions. So all you have to do is line up at the microphone and we'll give you a shout out, and then you can pose your questions to the panel. So panelists, let's get right into it. Many students come to Baltimore with preconceived notions. Maybe they've seen The Wire, perhaps they've seen the news coverage of the uprisings. What sort of things would you like students to be aware of through a different lens?
I would say to just have a different perspective on crime. crime usually is a cry out for help. And so it's a buildup of mechanisms from poverty, worry, struggle. It's a way of life. And we just need people to come in and to help our community, help people understand how to better themselves, and just be yourselves. Everyone has a story. No one wants to be homeless. No one wants to be in crime. If you take the time and show that smile, I think we could debunk a lot of myths about some of the citizens in Baltimore.
And I just add, just to speak to empathy, how important empathy is in terms of sort of doing service learning and interacting with the community and really being able to communicate effectively and listen and hear and understand where folks are coming from. I think oftentimes when you have that open communication, you'll find that there's actually a lot more that you may have in common with this community than you might think on the service, and just to sort of be open to that.
In terms of Baltimore, I've lived here almost 10 years now, and I've always felt there's a big focus on what's wrong with Baltimore, but there's a lot that is also right with Baltimore. It's a city of small neighborhoods. Every neighborhood kind of has their own thing. Artscape just happened this last weekend, which artists from all over the world are coming in. But lots of different theater and performances. Also, there's Light City happened the other year, and it's like the only festival that it's all based on like light art, and they had it in neighborhoods throughout the city. Some examples, but there's a lot of good here, and there's a lot of people that really do want to help the community and are willing to help. They just sometimes don't have the forum or the framework to reach out, so this is why these kind of opportunities are really helpful. I personally found I was here during the riots, and I was just so mad to see the coverage and how it just focused on the fires and people looting, when the city was very peaceful protests, a lot of people working together that normally wouldn't, to make the city a better place. But there's a lot of good, so.
And if I could quickly add to that, I came to orientation like 2 weeks after the uprising happened, so the perception I got when I got here was very different than what was on the news. And unfortunately, one of the people at the orientation said to me, "Don't worry about that. That's just like a select group. That's not how Baltimore is. There's nice areas and bad areas." And I really reject that, because all of Baltimore is this wonderful city that over the last 2 years has really pulled me in, and I'm from the West Coast and miss it every day, but I really enjoy and call Baltimore my home right now, and I love it so much. You can really spend this next year being in the Hopkins bubble, and there's nothing necessarily wrong with that. You could insulate yourself, or you can step outside and really start learning and seeing how this community is, like they say, it's Charm City. It's a very charming place. It's a wonderful place to live. So just keep every opportunity that Baltimore has to offer. There's festivals every weekend. There's restaurants and bars and all these things that are owned by community members. Go explore them. Talk to the other people that are not Hopkins affiliated, and really get to know this city, because if you're here for a year and then you leave, you'll miss that opportunity, and you'll just think about it the same way it's presented to you outside of Baltimore. So take this opportunity to get to know this city, because it's a wonderful place, and I've enjoyed it very much.
I'll add one more thing. When the uprisings happened, I think it's a sign of the progressive disinvestment in the city, and the fact that the city, we need more investment from the government, from the federal government, from the state. And so we can also take this as an inspiration for we need to do more, and we need to bring skills in working with communities, but also in pushing in policy advocacy as well, to bring about change.
Thank you all. So I'm going to push back on something that was said on the panel. I'm going to encourage all of you to get out of the Hopkins bubble. I'm going to encourage you to find ways, strategic ways, through coursework, through involvement with youth, through involvement with the opportunities that SOURCE offers, to develop a new understanding of Baltimore. Some of you may be completely unaware of what we're talking about. And so for all of you, I encourage you to take some time and explore the SOURCE website. There are modules that have been developed through collaboration between students, faculty, staff, community members to tell the story, not only the story of Baltimore and the history of the rich history that this community has, but to help you understand the story, the dynamic between Johns Hopkins and the local community. There are some dynamics that you need to be aware of because you wear it, whether you realize it or not. Every time you leave this campus, you represent that history. And so I encourage you, you already have your laptops out, go ahead and pull up the website, take a look, learn more. There will be some required viewing if you take service learning courses, but not all of you will choose to do that. So I'm going to encourage you to go ahead and do it on your own. Thank you, panelists. For our next question, I would love for the panelists to share with us different stories that keep you aware of the history of Baltimore. How do you approach your partnership and activities in order to continue down a positive path based on your understanding of that history?
Well, I'll kick that one off. And tap into what I learned from this wonderful team that are, that's at the soul of service learning, and that's the reflection component. For those of you who do indulge in a service learning course, you'll come across this concept called reflection. If you've done a class before that has it, great. For those of you that haven't, it is something that you do have to buy into, but to go to the answer of how do you stay on a positive path, it's a little bit of that reflection, or to use your word that you also brought up, this mindfulness. One thing that I also bring, I'm a kind of a, I practice yoga, and I'm maybe a yoga instructor wannabe, but it's that assuming rapport of between yourself and everyone you're interacting with, with my fellow panelists up here, you guys up there, that assuming rapport, that you can get along with anybody and everybody, I think is a huge thing too that keeps you going on a positive path. And that's something that you can really take in and internalize and kind of get into your DNA with that reflection and mindfulness component.
Building on the rapport comment, in no way am I trying to hide I'm affiliated with Hopkins, but I found if I start out on that foot, like, hi, I'm a volunteer from Hopkins, it automatically kind of creates a power dynamic where it's me and them versus us working together. And I have found that we connect as people just on the same level, having common experiences. And then afterwards, if they ask, or often, how was this started, that kind of thing. In small talk, you say Hopkins, and they'll be like, oh, okay. And then, and I'm no way hiding it, but it's just sometimes people hear that, that word, they hear that institution, and it separates the two of you. So I found not necessarily being boastful about it, but sharing if people are interested, just not to make me feel like I'm different than you or I'm better than you in any sort of way.
I think in terms of setting up the service learning projects for my classes, it's definitely a matter of listening to what organizations want and not sort of saying, this is what we want the students to do. And I have found that when I will go to a meeting, for example, that may have a number of community members at it, or community organizations at it, and say, we have students and they have capstones and they need to do practica, and they're available for your projects. They're so excited, and they'll all follow up with ideas and needs. So despite some of these conflicts in the history, people also want your help.
Our organization was founded, its original name was Parents Against Lead, and it was founded by 6 mothers who lived within 2 blocks of of Hopkins and all had children that had been in the emergency department for extremely high lead levels. And they came together and formed this organization back in 1986. And so it's, sort of embedded in the history of our organization, this intersection between Hopkins and the community. And I think, as an organization, we've tried to sort of always stay positive by looking at specific solutions, whether they are large or small, and sort of working towards those, knowing that we can't, solve everything at once, but sort of moving forward. I know one story that our president, Ruth Ann Norton, always mentions is, back in the late 90s, with the interaction with the community and sort of thinking about what the needs are to really start to address lead poisoning here in Baltimore, came up with a plan. The plan had a pretty big dollar figure. It was $50 million. It was called Windows of Opportunity. And people had felt like, well, there's no way that could move forward. And our organization ended up presenting that to the governor of Maryland, and almost that whole plan got put in place and helped to lead to a 98% reduction in lead poisoning in the state since the late 90s. And so we try to sort of think about focusing on what's possible and really sort of capitalizing on different opportunities.
Very valuable, thank you. So I've heard some really great tips, and I don't know if students caught them. I heard being mindful, I heard being aware of power dynamics. What are some other tips that students may need to be aware of, or things that they can do to prepare themselves as they enter into working with the community?
One of the most powerful things that was told to me my first year here, and I continue to explore this every day, is really understand the history of Baltimore and the history of Hopkins. And I think this kind of goes back to the last question, but there's a source module on the history of Hopkins in the community. I recommend everyone watch that, but start looking at artists in Baltimore and see what are they talking about, and writers in Baltimore. My first year, Between the World and Me, the Ta-Nehisi Coates book came out, and we read that as a book club, and he really talks about Baltimore in a way that's not necessarily presented to you in popular media. So really understand what are the community members talking about, and I think that's a great tip to really understand what's happening in the community around you.
I would say help is wanted, help is needed. If you find an organization that you would like to be involved in, understand their mission, because mission outweighs saying I'm from Hopkins. If you can identify with the passion of the community resource there, what they're trying to do, that outweighs any negative thing. Because when people work out of their passion, it just has a whole different tone to it. So if you're compassionate and you want to help, then it's welcome. So stay focused on the mission and not just that I'm from Hopkins.
Kind of on that point, I was thinking in terms of choosing something you want to get involved in for a service learning project or practicum. Choose something that you really do feel connected with and passionate about. Don't choose something just because it's easy or necessarily convenient, because it comes through as genuine. It can make a lasting impact on the community. And working with the Identity Clinic, it's my favorite part of the week during the school year. That's my tip.
So one of the most common pieces of advice, and one of the most important ones, is to be humble and recognize that you're coming in there to listen and to learn just as much as you're coming in there to give. And that's a really, I can't say that enough times. At the same time, I want to give you both that and then a sort of a separate piece that goes along with that. So in my class, we very often get into these very heavy discussions where students are saying that they've almost taken that too far. So they feel so humble that they feel like maybe I don't have a place. Maybe it shouldn't be me doing this work because somebody else should be doing this work who comes from the community. And so I think this just speaks to the real importance of the reflection. Whether if you're in a service learning class, that's great because you'll have that opportunity. But if you're not, find other ways to kind of process those emotions and think about who is appropriate to process them with. But lean into that.
Thank you. I hope you were taking notes. Some really great tips offered there. So I have one more question for the panel, and then we're going to take questions from the audience. So if you're thinking through something, maybe you want to jot it down and hop in line. So to the panel, we are talking to the School of Public Health MPH students. So I would love to hear from you. What are some of the health challenges that you've noticed through your work and in the community? And how has Hopkins and the community worked to overcome those challenges?
So I think, environmental health is, core to the mission of our organization. And one of the ways working with Source that we've helped with that is around asthma triggers. And so we actually had a set of materials that we used to provide education to the community members about things that might trigger asthma, environmental tobacco smoke, mold, dust mites, those sort of issues, and had a group of students look at our materials and sort of and do a scan of sort of best practices and do a full-on update to all of those materials, and it was very helpful because we just entered into a new partnership with Baltimore City Housing Authority, where they had seen within the Housing Authority that they had a lot of issues around asthma and wanted to make sure that they had sort of had the best partnerships, and so we just had a new partnership. So it was a great moment of time to have the students look and update materials for us.
Hello. And now we're awake. I'll chime in at one of mine that I've observed, that wasn't particularly surprising, but was a trigger for some big reflection, is access to education, and on the flip side, obstacles to getting education. And this is education in general, and certainly kind of near and dear to my heart is sex and reproductive health education, but it extends more broadly. And I think this is a biggie for all of us to think about, because I think everybody in this room has been a major benefactor of your access to a quality education. That's what got you admitted here as a graduate student at the Bloomberg School. I could tell a very similar story about myself. And a biggie is to think about not taking that for granted and bearing in mind that this is, I'm sure for many of you who have volunteered before, this isn't necessarily a surprise, but to always be very grateful for that opportunity that you've had, and channeling that in an energy to want to give that back and to try to do what you can, within the context of working with the needs of a CBO to make that access, to make that education access more attainable, because I think that's a game changer, not just for the current generation, but moving forward in future generations too.
I'll talk about food insecurity. So a quarter of the population of Baltimore is food insecure, and about a quarter has low healthy food access. And Baltimore, over the past number of years, has become one of the leading cities in the country working to address these issues. And a lot of that has been because of partnerships between Hopkins students and faculty, and both Baltimore City and a number of organizations within the community, implementing all kinds of really creative and forward-thinking interventions.
It's hard not to feel overwhelmed sometimes about all the social challenges, which, as you all know, affect public health. But what's been predominant and what I've been seeing is homelessness and addiction. And again, the barriers to good health, and ID is one of them. And I think it's a very worthwhile venture to kind of address some of those barriers, and you can't do every single little thing, which to fix every social problem, education, being able to get good jobs, crime, but you can help the little, perfect is the enemy of good. And whatever little part you can do is good.
So most of my experience working as an infectious disease provider and in research and with the community has been in HIV and hepatitis C. So I'm sure since the 80s, there's been a drop in incidence and prevalence of HIV. But in Baltimore City specifically and other cities around the country, if you are Black and identify as a man who has sex with man or a transgender woman, you have a 1 in 3 lifetime chance of getting HIV, which is astronomically high compared to the general population. Baltimore, through Project Impact, which is a CDC-funded project, has brought together all the federally qualified health centers who provide HIV care with Hopkins and the health department to really start rolling out PrEP, pre-exposure prophylaxis, linking people to care who are HIV positive to try to get people who have HIV virally suppressed, which reduces vectors of transmission, and then thinking about not only the medically relevant interventions that we can do, but also what are the social components of that. So do we need to have social workers on our team who connect people to getting identification or a home that's not in an area with high lead contamination? Really thinking through these wraparound services. So there's a lot of opportunities there for this great research and evaluation that's being done by Hopkins and community-based organizations where students can really plug in and offer their expertise and services while learning from the community at the same time.
Okay, so hopefully you captured that in your notes as well. I know you all are required to execute practicum, and there were some non-traditional ideas presented here, thinking about cross-field collaboration to address health justice, access to food, ID and education as forms of like health justice, I think is a really exciting topic for students to think about. So really valuable answers. Thank you so much to all the panelists. And here's the part where you get involved, not just in the community, but in the conversation. So I'm opening the floor. What questions do you have? And we are recording, so I would love for you to move to a mic if you have a question so that we can hear and capture not only your question, but the answer. Don't be shy. Go for it. So because we're recording, I would love for you to yes, utilize a microphone. Thank you so much.
Thanks for your time. It's been super interesting to hear all of the various projects and initiatives that you're all involved in. I'm just curious, so we've been talking about, a lot of the positives. What are some of the things that you're doing that are not working? What are some of the repeated challenges that you continue to face?
I'll share a challenge. So in the service learning class that I teach, every year there's, let's say, 5 teams. And almost every year we've had one team that's run into significant challenges. And often that's had to do with communication issues. But I would say that there are these challenges, and that kind of comes with the territory of doing this kind of work. Well, it's not easy, and it's not simple, and it's not clean, but it's important to kind of go through those challenges to get where you're going. And so, for the students that are in that group that's having a challenge, I think it's really important to sort of, what's that bringing up for you, and what are you learning from going through that challenge, and what does that teach you about what you might do differently next time? So I think going through that is also an important part of the experience.
That's a rich answer. Thank you. Another space for reflection. Yes.
Hi. Thank you very much for this wonderful opportunity. I'm a pediatrician in Japan, and I'd like to know whether there is some program relating to child health or some school-based program.
Child health or school-based programming that you can speak to?
I don't know, we should let you answer this one, but I know of the Children in Crisis course
That is correct.
that starts in 3rd term, goes into 4th term. I know students that I advise in our master's program have gravitated to this and loved it, but maybe, I don't know if a source member wants to comment further on the nuts and bolts of what that Children in Crisis course is all about. But that's one that I've gotten consistent feedback from students that they have loved.
So I wanted to give deference to the panel first and not hog the mic. So there are opportunities connected to coursework, such as has been mentioned, Children in Crisis, which sounds like a really intimidating title. You don't actually have to help a child transition out of crisis in the short time that you're in the course, but the course really looks at opportunities to address what is often called in the research ACEs, so adverse childhood experiences, and the curriculum covers what that looks like. And so your service learning opportunities gives you an opportunity to be involved in programming that's happening in the community and that's happening in school to really provide for young people rich learning and mentorship opportunities. Co-curricular speaking, we heard a little bit about the work of Living Classrooms, so not only do they do an amazing partnership through Identity Clinic, but they have a number of opportunities across the city that really allow for young people to develop STEM skills, to partner with mentors, to really understand more about environmental health and environmental justice. So the short answer is come and see us. There are lots of opportunities and we would love to help you navigate them. Thank you. Great questions. What other questions do you have? Well, good news. We are here to answer them should you think of them later. This is the part where I close off with one last commercial. So just to tell you a little bit more about opportunities for you to get involved, you can sign up right now, since you have your laptops all out, or perhaps your cellular devices, to receive The Scoop. So that is the Source weekly newsletter. It comes out every Tuesday. If you sign up today, we might be able to get you in for tomorrow's Scoop. If not, definitely next week. You'll hear about all types of courses, service learning opportunities that are co-curricular as well, and it gives you the chance to hear about opportunities even within our office. So we are looking for federal work study students, and if you need a stipend or perhaps would like to build your resume, we would love to have you on our team. There are 4 positions currently open, so definitely sign up for the Scoop so you can find out more. Interviews are already taking place, if I'm not mistaken, so we need your help, and we'll pay you for it. The other things to be mindful of is that Source has kicked off today and running through Friday our school supply drive. So we talked about ways to support our young people here in Baltimore. This is a really easy way for you to just drop something and go. There are various places for you to drop your school supplies. So the Student Affairs Suite, which is E1002, the first floor Student Lounge, and the Source office, which is W1600. As well as in the School of Nursing, if you happen to just pop over and grab something from the cafe there or something, you can drop your school supplies at any of those locations today through Friday. Also, mark your calendars. Source will be hosting an orientation on Wednesday, the 2nd, in W2008. So if you want to hear more about ways to get involved in both our curricular and co-curricular opportunities, it is a great opportunity for you to hear from Shane and I, who will lead you through all things Source. And finally, MPH Day of Service is happening on August the 5th. So it's an opportunity for you to partner with students in the School of Nursing and in the School of Medicine to serve some of our great community partners. On a Saturday, you get a really great t-shirt, and you have the opportunity to connect with students who are passionate about getting involved with the local community just as you are. So, your action. Your computers are already open to our website, right? Now open an email. And in that email, type in source@jhu.edu. And in the subject line, put what you're interested in. It could be our Scoop. It could be the opportunity to be a federal work study student. It could be something that I haven't mentioned yet, like our social justice task force. Your antennas went up, I just saw it. You can put any of the things that we've mentioned today in the subject line, and we'll follow up with you. Just as easy as sending an email to source@jhu.edu. I can see all of you doing it right now. We have cell phones out, it's perfect. Your action item is completed, checked off for this learning opportunity. So I'm gonna close by allowing you to give our amazing panelists a round of applause. Can we thank them for their time today? We have about 10 more minutes. That is not true. We have about 6 more minutes in this space. If you'd like to come and shake their hand and thank them in person or perhaps pose a question, please feel free to do so. Thank you.